So this is how I properly prepare the SlimPlus injection. You want to remove the top part of the bottle without removing the whole entire part. You will see that it is perforated. You want to draw back air into the syringe and push it in. This is going to displace the product that we are drawing out. You want to fill your syringes up completely all the way to 100. After you have that, we're going to inject in increments of 20 units. So starting from 100, you go down to 80, then down to 60, then down to 40, and then down to 20. And then you have your last injection. So for each syringe, you should be able to get about 4 to 5 injection points. You want to mark the area, whichever area you're going to do the treatment on, about 1 inch to 1.5 inches apart. Here you just see slowly injecting the serum into each marking. You want to pinch, stick, and then slowly inject the serum. You want to make sure that you're putting this in fat tissue and not the muscle. So that's why you want to make sure that you pinch up in each area. Take your time, go slow. As you go, you can wipe off the little X's that you make to make sure that you keep track of where you've been already. But it's pretty simple. Make sure that you start with clean hands, of course. Make sure that you properly draw back your injection needles all the way to 100 units and take your time. You can use an over-the-counter numbing cream, something like Aspirin cream. Apply that to your stomach first. Let it sit on there for 15-20 minutes. Wipe it off. Clean the area really, really well with alcohol before you get started with your injection. But it's fairly simple. It's no extra technique or anything needed. Just make sure that you make your markings 1 inch to 1.5 inches apart. Now, if you are doing this on your arms, you will not need as many. You probably can fit, depending on the size of your arm, 2 to 3 syringes on each arm. The same for like the inner thigh area. You will only need about 2 to 3 syringes. If you're doing this on an area like your back, you will probably end up needing assistance. But if you're doing an area that you can reach yourself, it's pretty simple. Pinch, stick, and move on to the next spot. You want to make sure that you administer the entire vial in one setting, if possible.